Hello, everyone. Welcome back to another week of Bella TV. I'm your host, Danita Chantel. And as you know, Bella always brings you things entertainment, lifestyle, arts, and culture. And today we have a topic about health and wellness. We have Dr. John D'Angelo, who is the Chief Medical Officer of Citiva. He's here to talk to us about a topic that's been in the news quite often. I'm sure you heard about it. Medical cannabis. Hey, Doc, how are you?
Thank you. I'm great, and I'm happy to be here and share this all with you today. So, right in front of us, as you see, what we more typically would call a marijuana plant.
You brought us product.
You know,
joking.
But the beauty of cannabis is that it's been nature's gift to us. All right, and there's a lot of the components of the plant that we've now discovered have been really healthy for us. So when we look at the plant, what we've done in the medical world, in sativa in particular, is try to break the plant down into the components that we know will provide people the best health benefits. So everybody's familiar with THC. THC is that part of the plant that creates the euphoria. It's that part of the plant that creates the so-called stoned effect that people are more familiar with. But that plant also has about 100 other chemical components called cannabinoids. And these cannabinoids are really health producing for us. They're potent anti-inflammatories. They help to promote healing in the body. And what we've discovered is by harnessing the combination between the cannabinoids and the THC, we can create a medical product that can be used in a variety of issues.
Wow. So you just explained the difference between what's recreational and medical marijuana. So what does your company offer compared to what we find like that's more recreational?
All right. So basically in the medical market in New York State, we have 10 companies that have been licensed by the state to produce and grow medical cannabis. And what sets medical cannabis apart first is the standardization. Right? It's because it's a medicine. Every time you take it, it needs to be exactly the same as it was before. It can't be changing. So the standardization is the first part. And how we do that is we grow our product. Everybody has their own genetics or the plants or products that they feel most comfortable with as a company. We believe our combination of plants is best suited for the disease states that we're treating in New York State. And we process the plant down to an oil. And then from that oil, we develop a delivery system. So in New York State, there are several ways you can take the plant, so to speak, because we don't sell flower product
You don't
in
sell
any
this
of our
actual
dispensaries.
product.
Correct.
Okay.
So we produce it into an oil. And the more common way that oil is then distributed is something called a vaporization pen. And I think the important thing for people to realize about this is even when you see smoke coming out of a vaporization pen, it's not like smoke that's coming out of a cigarette. It's water vapor.
Okay.
All right. So, and so it's a very different thing. So that whole secondhand experience from cigarette smoke doesn't really apply to vaporization because it's really just steam that you're seeing. Excellent way to use the product because it has a rapid onset of action and it has a short duration. So that's one method. The other method are capsules. So the oils are packaged into capsules, very similar to like fish oil capsules that people take a lot today. And the beauty about the capsule is that it has a longer duration of action and it takes a little bit longer to kick in. All right. And then there's a tincture. So the tinctures are basically alcohol-based preparations that get dissolved under the tongue, have a rapid absorption again. So for people who can't use a vape pen or for children, right? Because one of the more common things that we treat with medical cannabis that everybody probably is aware of is pediatric seizures. So there are certain seizure states in kids that respond very well to medical cannabis. And this is often the way we prepare it and deliver it to the children.
Well, how did you get involved in this?
So about 4 years ago, really the topic kind of appeared on the radar in New York State. And so I was curious and I thought this is another one of those things. Doctors often dig our heads in the ground and we ignore things that are going on around us. And I said, whether or not I'm going to believe it or not, I need to learn everything I can about it. So I first went around New York State and met with a lot of the families who had driven the legislation. And I think that's what moved me. It's not often that you see patients really drive healthcare. right? It's
But there was a
usually
need.
correct.
Obviously, there was a need.
And they saw the need.
Mm-hmm.
And they went to their legislators and they said, hey, the regular medical system isn't meeting solving our problem.
Right.
You know, we want to be able to give our kids something else, to try something else. This is safe.
Mm-hmm. It's natural.
Why can't we try it?
Right.
Correct.
And now you mentioned to me prior that you had to talk to your colleagues a little bit. Like, what was that conversation like when you told them you were getting into the business?
It was odd in the beginning. It was very odd. And I would say for the first few years, I kind of thought they were all just looking at me funny. You know,
but you're you're a smart man.
Yes, and I think they respected me,
right.
but they thought maybe I had lost my mind a little bit.
No.
So, however, 4 years now, I think people have really started to understand the medical benefits.
And the public is more educated about it, you know?
Definitely. And even on a political level, right now there are about 30 states who have medical cannabis laws now. So it's not what it was before.
Right. The stigma is erased from it.
Exactly.
And people are educated. They know that it's a benefit to it. It's helping patients like children or people that have cancer or, you know, things that they can't see.
And it's another tool in your belt,
right? Another tool in your belt.
Nothing cures everything. But, you know, if you have a child who's seizing all the time, that means that child is never hugging you, never giving you a kiss. It's kind of a thankless job, right? As a parent. To have a medicine that just makes your kids smile, that makes you enjoy a memory, makes you be able to have contact with them, you know, it changes the whole dynamic in a family. It's not just about that disease. It's about a family.
It's quality
and how
of life.
It affects it. Exactly. And so what we're finding with this, and now New York State has just recognized that cannabis is going to be a great aid at helping people to come off of opioids.
Great. That's fantastic.
So in New York State, we've just expanded our regulations so that cannabis can be used in that manner. And what we're seeing in states that do that is that there's about a 50% reduction in the use of opioids when you add cannabis. Cannabis doesn't kill, opioids kill.
Right. It's such an epidemic now, and that's sweeping across the nation and also around the world. Like people dealing with opioid addiction, and it's really rough on families.
Of course. And every opportunity you have to keep somebody alive is an opportunity to help heal them.
Right.
That's really the reality of it.
Wow. So where are the dispensaries located?
So our dispensaries will be located in downtown Brooklyn, down by the Barclay Center, on Staten Island, in Wappingers Falls, and then our last dispensary will be out by Rochester, New York.
Wow. So as you mentioned earlier, people would have to go to their doctors.
Yes. So the way it works is you go to your physician. If you fulfill one of the diagnostic criteria in New York State, and those criteria are things like Huntington's disease, Parkinson's, chronic pain, neuropathy, inflammatory bowel disease, chronic pain of almost any etiology, and now anything that you might use an opioid for, cannabis is something that you can use also. If you fulfill one of those criteria, you get registered with the state, and then the patient receives a card, and with that card, they can go to the dispensary.
Okay, and will be able to either get the oil, the pill.
Right. In every dispensary, there's a pharmacist, and the pharmacist will help direct the patient based on whatever their medications are that they're taking, what their other illnesses are, and to pick the mode of taking a medicine that's most appropriate for them.
Wow. Well, this is great as far as giving the other options to patients other than opioids and risking getting addicted.
Correct.
Where can we find out more information about this?
So certainly New York State has a website called the Compassionate Care Act of New York. You can definitely go on that website. They give you all of the information about regulations. And certainly you can go on our website, which is citivamedical.com. And also you can get information there.
Wow. I feel so informed, educated, and I feel like our audience has a clearer view on how medicinal marijuana can help people out, you know, as far as their wellness and everything.
Good.
Yeah.
Good.
So,
you know, as I said to you before, I just want to add 1 out of 5 Americans takes a prescription medication for depression or anxiety. All right. Yeah. That's telling you that people are looking for something that's more effective at helping them handle the stress of everyday life as well as the illnesses that come along from the stress of everyday life.
Right. And more holistic where it's natural.
Correct.
There's nothing added to it. It's
Correct.
nothing like that's more pharmaceutical drugs and things like that. It's
Correct.
natural.
And what the literature has shown over and over again, there has never been one recorded death as it relates to cannabis.
All right.
So,
well, that is so good.
safety.
I'm so glad that you're here.
Thank you.
You have to come back and talk to us more as you forge
Thank
ahead
you.
in the business. And
I would love that.
Yeah,
I would love that.
we would love to have
You
you
know.
back as well.
And this is a great topic. And if viewers have any questions, they can go to the website, they can ask questions, and that will get feeded back to us, and then we can respond.
Oh, well, thank you so much. Well, there you have it, guys. We just had a lesson about medicinal marijuana and how it can benefit us as far as health and wellness and helping those out there that may need different options for treatment of what they're experiencing as far as their health. So make sure you tune in to BellaNYMag.com, and we'll see you next week.